All right, let's get started.
Okay.
My name is Lisa. I've never actually appeared on a WellCore video before,
so
but
exciting.
I've been behind the scenes helping Dr. B and the whole team with marketing for a while, and today I get to interview you for the first time. So for anybody who hasn't met you before, Dr. B, can you just introduce yourself a little bit?
Yeah. I am Dr. Bethany. I'm a pelvic floor physical therapist. I founded WellCore PT in 2020, which is, the best time to start a business, as
one does.
Yeah. And I just love all things pelvic floor physical therapy because I think it just is such a, it makes such a difference in people's lives. And I've had my own fair share of pelvic health issues. So really that's kind of like why I started getting into it. And and now my daughter has had some constipation stuff. So I've just kind of, it's just all around us.
It's everywhere. And not a lot of people love to talk about it.
No.
But here
turns out everyone pees, poops, and has sex. So there you go.
Everybody needs it.
Yeah.
Okay, so today talking about constipation, very flashy subject.
Oh yeah.
One thing that I have learned just talking to you as my pelvic floor physical therapist is that constipation as just an everyday person out and about, I think of it as you can't poop, and you haven't in a long time. But as a medical professional, what would you say actually constitutes constipation?
Yeah. So, I think if you go to like a gastroenterologist, the, medical definition, I kind of have that written down over here, is that the medical definition is pretty broad, and it basically is like infrequent bowel movements less than 3 a week is what it's considered medically constipation. However, when we get to that point, that's when we're seeing, a specialist and like having to do a lot of things to get things going. So I like to see people having a bowel movement most days of the week. Now, diet and exercise and hydration and all of those things make a difference, which we'll talk about. So if you tell me most days I have bowel movement, it's easy to pass, it's soft and formed, and I pretty much know if I have a weird McDonald's several days in a row or something, Taco Bell, whatever it is, and then I'm constipated or have irregular bowel movements. That is, we're not robots. But, yeah.
So anything that's outside of that normal, and I think what I just heard you say is normal is preferably daily, but at least every couple of days, and then easy to pass. Talk about that a little bit more. What should it feel like?
Yeah, it should feel like if you go to sit down on the toilet, you don't have to strain. You're not sitting there for 30 plus minutes. You should be able to pass a bowel movement within about 5 to 10 minutes, 10 minutes being on the longer side. So if you have, unless you're just hiding in the bathroom, that's a different story, but
from your kids or scrolling.
Yeah. But from start to finish, the actual passing of the bowel movement should happen fairly quickly, 3 to 5 minutes. And then it should be soft formed, and you should have pretty much one soft stool. It's not hurting when it comes out, and you're not having tiny little rabbit pellets or diarrhea.
Yep. Which on social media a lot, you talk about the Bristol stool chart, not a star chart. Yeah. That's different. Yeah. Bristol stool chart is something that's easy to look up, and we can send that out as a resource after this webinar, so that you can actually see a little picture of what it's supposed to look like.
And there's a free app called Happy Poop that I use with a lot of my clients that you can track your stools. You can track a lot of things on there, but it has the Bristol stool chart on there that you can kind of see.
There you go.
Yeah.
Okay, so now that we kind of know what constipation is, how you define constipation, why would it be a problem if somebody's not pooping regularly? To your body.
It doesn't feel good. So a lot of, bloating, we can actually see some urinary issues, the rectum and the bladder. In females, we have the vaginal canal in between, but it's pretty, that's a very squishy canal. So that if we're backed up, that can push on the bladder, which can make incontinence or urinary issues worse. Bloating for sure, like you can feel abdominal distension. And people sometimes don't feel like, well, I just don't have the urge to go to the bathroom. It's still considered constipation. It just, your body has determined that like you don't go to the bathroom every day. And so it's stopped giving you the urge, or it takes more stool for that urge to come. And then actually hormonal issues can be a big thing as well. Our body regulates our hormones and the balance in our body by getting rid of what we don't need. And so if we are backed up or we have things that are not coming out, then it kind of like messes with the whole system. With my daughter, I always tell her it's our body's way of taking out the trash. So if we let the trash sit in our house too long, then it starts to stink up the whole house. Yeah. So it's kind of throws everything get it out.
Yeah. So there are some symptoms too that a lot of people might think are normal other than just not having a bowel movement.
Yeah.
What are some of those symptoms of being constipated?
Like
wiping over and over
again.
Like how might you know?
Yes.
Okay. Yeah.
So sometimes we're going to the bathroom every day, but we're having like hard little rabbit pellets, or we're not completely emptying. So we might go to the bathroom like 5 or 6 times a day, and we're just getting like one tiny little stool out. That can be a symptom. You can have excessive wiping. So if you have bowel movement and then you're wiping 5, 6 plus times.
Wiping a marker.
Yes.
As my husband
would
say.
Yes. That can be a symptom. Should be like 1 or 2 wipes and you should be clean. And that's not like a cleanliness thing. That's your body is like leaking stool because it wants to get more of that trash out. And it's can't do it in a formed bowel movement.
Yeah. Okay. This is maybe one of the funniest interview questions I've ever had, but let's say you're going to go sit on the toilet right now.
Yeah.
What would you recommend someone do if they're sitting on the toilet and nothing's happening, nothing's coming out?
Like how to poop.
Mm-hmm.
Okay.
Yeah, essentially.
Yeah. So if I feel like I do this. Do you want to learn how to poop with me?
Yes, I do.
Okay.
Obviously.
You didn't think you'd have to practice pooping on camera, did you?
I'm here for it.
Yeah. Okay. So if we maybe scoot this back a little bit. Okay. So if we're seated on the toilet, we are going to elevate our feet so that they're a little bit above our hip height, and that puts our pelvic floor on slack a little bit. Squatty potty is the most well-known toilet assistance device. But yeah, elevate your feet, and then you're going to lean forward onto your knees a little bit, and then you're just going to take a deep breath kind of into your belly and like rib cage and let everything relax. And then as you blow out, that's when you're going to bear down a little bit and lengthen your pelvic floor, but you're going to like let the air out through your mouth. So like that is really nice.
To.
Yes.
Wait, I wasn't in the practice round.
No, you don't have to if you want to, but you can do it. You can try it for us. You got it. Lean forward. Inhale. Oh, that's your chest. There we go. So kind of breathe into your belly. Let everything relax and lengthen. And then as you blow out, that's when you're kind of bearing down and like letting the poop out. Yeah. There you go. Yeah. Perfect.
Perfect poop.
Yeah. Perfect poop. Yeah. So you shouldn't have to, you might feel like you have to hold your breath or kind of bear down a little bit, but you shouldn't be holding your breath, pushing against a firm pelvic floor. So it should kind of feel like the pelvic floor can lengthen and open as you're letting the air out, which is allowing the poop to come out. So anytime we poop, the pressure in the rectum, well, let me just bring out my pelvis. The pressure in the rectum has to be higher than the pressure in the anal sphincter or the pelvic floor to get poop out. And so that's why a lot of us want to strain, and it feels like we need to strain to get poop out. But if we have to strain, that's creating a really high pressure situation. And sometimes poop comes out, but then other things can come out too. So like that's when we get hemorrhoids or anal fissures, which is like tearing of the anal sphincter muscle. Hemorrhoids is like a blood vessel that's kind of popping and coming out, and that obviously leads to pain and then more trauma to the pelvic floor over time. And so if we let the air out, kind of let that come out through our mouth, that helps the bowel movement come out, and then also doesn't put more strain on the pelvic floor.
Makes sense.
Yeah.
Yeah. Okay, so if that's what it's supposed to look like and it's not happening, what is your first? Oh, we froze this for a second. I just want to make sure we're good. There we go.
Okay.
What is, so you're sitting there, you're straining, nothing's happening. What would you recommend somebody do?
Yeah. So if you've been sitting for like more than 3 to 5 minutes, you might still have the urge to have a bowel movement. Nothing's coming out. I would get off the toilet and then go take a walk, do like a little bit of yoga. There's some really good constipation yoga videos on YouTube that you can Google. There's like meditation, pelvic floor guided meditation to help your pelvic floor relax. Anything like that to kind of like help just like distract you a little bit, but then also give your body more time to
be ready
to have a bowel movement. Yep. Do you want me to show you some of the stretches?
Yes, I do. I want you to show me.
I could see it in your eyes.
Yeah.
Okay, so a lot of it is on the floor. Well, I had you in a good spot. Okay, so a good one to start is just kind of like a deep squat. So kind of getting anything that's like,
I'm gonna get my legs out of the.
Yeah.
I'm just gonna let you do it.
Okay, great. A deep squat. So you're kind of like putting pressure on the abdomen there. There we go. Putting pressure on the abdomen here. You can lean against your couch if you need to, or sit on a yoga block. You can anything like that and just kind of hang out here. That helps lengthen the back of your pelvic floor and your sacrum. You can do child's pose if a deep squat doesn't feel good. You don't need to rock all the way back on your heels if you have knee issues, but just kind of getting into like this position. You can use a couch or a chair and kind of lean here and just kind of breathe into the back of your body and your pelvic floor. Breathe into your butthole, if you will. And then you can also use a small Pilates ball or a rolled up towel and lay it on your abdomen. We have our colon, which goes from right to left, empties on the left side. So if you kind of like press on your abdomen with your hands or a towel or a Pilates ball and just kind of like massage. So it goes right up to your rib cage, and then across is your transverse colon, and then down is your descending colon. So you're kind of going in that direction. We call this the I love you massage because we're going I, and then an upside down L, and then an upside down U, like that. So,
do you do that when you're sitting up, standing up, laying down? Does it matter?
Wherever. You can do it while you're seated on the toilet. You can do it standing. You can do it. I feel like it is easiest to relax if you're laying down like on a couch or on the floor or something like that. But wherever is most comfortable to you is great. So sometimes people like to massage on even while they're seated on the toilet, and just kind of like, it just kind of feels like it gives your body that like urge to poop.
Well, essentially, are you literally kind of moving it through your colon by going that pattern?
Yep. So, I mean, a bowel movement is rightfully named because it's a movement of the GI system. And so our colon and our intestines are smooth muscle. So they're not skeletal muscle like our, biceps and pelvic floor and hamstrings, but it is a type of muscle tissue. And so we can help that muscle tissue by like massaging it and moving it. It should kind of do that on its own, but fascially, sometimes when we're constipated or backed up, things just kind of get tight or sticky. And so that like movement of the abdomen and the colon really helps things keep moving.
Mm-hmm.
Yeah.
And then I know as a pelvic floor PT, you use cups for the same type of thing. Do you want to explain what cupping is? And
I love cupping because it's really easy, and it's not, a lot of times people think they're going to have, bruises or things like that. We use cupping as like a fascial release. And so it is pretty gentle, and they're pretty inexpensive. So it's a great home tool. So we just have these like silicone cups that you can get on Amazon or wherever. And then I just use coconut oil. You can use any type of like massage oil, or if you have like a lemon essential oil that you like to mix, that is kind of nice for like the GI system. So to use it, you would just like put a little bit of oil on your hands, and I'll just show you. I would do this laying down, but I'll kind of show you on myself here. You just kind of put the oil on your hands and then massage that in. And then you're going to take the cup and squeeze it, and then just place it on your abdomen. And then it should kind of like, you're not pushing down, you're just kind of like letting it glide across the skin. So it should move pretty easily, and you're just going in that same direction of your colon. So right to left, you're squeezing, placing it. If it pops off, it's okay. And then just kind of let it go around like that. So if that feels like really difficult or painful, I would definitely follow up with a physical therapist or a professional, because it should feel pretty light and easy. Like my stomach is not super red after that.
You don't have those like big welts or anything.
Nope. And you're just going to keep moving it. If you let the cup sit on your skin for too long, it will like bring blood flow to that area. So it will leave a bruise. But if you just kind of keep moving it along that path, it's a really nice, gentle fascial release. So,
and I'm a baby when it comes to pain, and you've used these on me, and it does not hurt.
Yeah. So just be really light with it. You can overdo it. So just be really, really light. 2 to 3 minutes, but sometimes it's just another way to kind of get things moving.
Yeah. Okay. So for once you get yourself regular and you figure out what your normal is, I know you talk about 3 main things that can keep you regular. That you focus on. What are those 3 things?
The 3 F's: fiber, fluid, and physical activity. So fiber, we have insoluble and soluble fiber. You can always Google those and go way more in depth with those with a dietitian or on the internet. But soluble and insoluble fiber help kind of things move through the digestive tract, and they kind of do that in different ways. And then we have fluid, so lots of water, and then electrolytes can be a huge help in getting things moving because they have extra minerals in them like potassium and sodium that help things move through the system, helps you process the fluid in your food better. And then physical activity. So walking is probably the best and easiest thing to like add to your morning. But usually if people kind of pair those 3 things together, especially like if you're trying to go to the bathroom in the morning, trying to do like a whole glass of water, sometimes adding lemon or like electrolytes to your water helps, doing like a little walk, and then eating like a good fiber rich breakfast, all of those things, that should really do the trick.
Yeah. So you have also talked about those are the 3 things. If somebody's doing all of those and they're still backed up, can you talk about the difference between like what is probably happening with your pelvic floor then?
Yeah. So if we're doing all of those things and we're having to be like overly consistent, or if like we don't one day do like our super big fiber rich breakfast, then we're backed up for a week, like none of that is normal. And so a lot of times the pelvic floor is too tense. And so what we do in pelvic floor PT is use like the exercises, the cupping, our manual therapy techniques. We can do like some sacral fascial work. So this is the back of your pelvis, your lumbar spine, your sacrum, and then your 2 SI joints, your tailbone, and then your anal sphincter and rectal opening. So all of this has to be able to relax and get out of the way for poop to come out. And if it can't relax and can't get out of the way, then that makes it really difficult to go to the bathroom. So you can see like long, skinny poops when you finally do go to the bathroom, or you're having to get up and down from the toilet several times, or the urge is going away because the pressure in the rectum isn't high enough, like we don't have enough stool there, and so it's not able to get past that anal sphincter. So then we'll have like 3 days of buildup and then a huge bowel movement. All of those things are signs that your pelvic floor is a piece of the puzzle.
Yeah. So in other words, you can eat all the fiber in the world, be super
Right.
hydrated, be moving all the time. But if your pelvic floor, if the muscular part isn't there,
Yeah.
then so at what point are you looking at talking to a pelvic floor PT
Mhm.
or a medical professional?
I mean, I think at any point it's worth talking to a pelvic floor PT, but
Mhm.
obviously I'm biased.
Sure.
But I think that like if you're struggling with it, or you're feeling the effects that we've talked about, like bloating or, you know, like you're having hemorrhoids, anal fissures, any of those things,
Mhm.
along with talking to your primary care or GI doctor, I would also see a physical therapist. I think we're starting to get there where people are recommending PT more frequently, but not everyone is recommending PT. And so I think that, yeah, I would always pair those two things together, because it's not going to, even if there's a GI problem that you need to
Right.
solve, when there's a GI problem, your muscular system also responds. And so, yeah, if there's like Crohn's disease or you have an allergy or something like that, that's impacting your GI system, your muscular system is also guarding and protecting. And so then it tightens in response. And even though we fix the GI issue, our muscular system might still be in like hyper tonic state of just like trying to guard and protect.
Sure.
So
is it possible then that somebody would get stuck in a cycle of like, they think they have it figured out because they've added the fiber, the water, the movement, they have a few days of normal, and then it gets stuck again, and you're like 3 or 4 or 5 days, and then you're able to go, and then you get stuck again in a cycle? Is that probably muscular?
It can be. It can. A lot of times they call that like a slow system, and so you're having to like really work hard at like getting that system moving. It can be like a number of different things, but a lot of times what we see too is like when you've been constipated, like when we have chronic constipation, this is your rectum. When we have chronic constipation, the rectum distends and gets bigger, and then it can stay like that. So if we have a sensor in our rectum, so as it's filling up with poop, the sensor tells our brain, hey, it's time to go to the bathroom. And then we have about like 3 to 5 minutes to get to the bathroom before our body is like, oh, she can't go right now. And then it sucks the poop back up, and then that urge goes away. So if we're regularly bypassing that system, then it takes more and more and more stool for that sensor to go off.
Interesting.
So this rectum like gets bigger, and then the sensor doesn't go off as regularly because our brain really tries to be helpful, and it's like, oh, she's too busy to go to the bathroom. So we're just going to wait. She must only need to go to the bathroom when she has this much stool instead of this much.
Interesting.
So that happens a lot, and that is when it takes, you know, it depends on how long the constipation has been going on. Sometimes really quickly, once we start going, our body's like, oh, okay, she wants to go every day. And then we start going every day. Sometimes it's like, it just takes several months of being really consistent and telling our body repeatedly that we have time to go to the bathroom and we want to go to the bathroom and all of those things. So that is most commonly the issue. And so you can actually like sit on the toilet even if you don't have the urge. So a lot of times I have people do it, and kids too, like after dinner. So you have 3 full meals in your system. You should have made lots of poop by that point. So you should have the ability to go to the bathroom if you need to. So it's really important that you're eating enough throughout the day. And then about 20, 30 minutes after dinner is when we should have like an urge to have like gas, stool, some gurgling happening. So that's when you would go sit on the toilet, do that posture we talked about, breathe, try and like relax pelvic floor, bear down a little bit, and see if we can get that urge to come back. It's not going to come back typically that day. It takes
practice.
Yeah, practice, and like your nervous system has to be like, oh yeah, okay.
I've got to go.
Yeah.
You mentioned kids.
Yeah.
And I know you've talked about constipation being one of the main pelvic floor issues with kiddos.
Yeah.
Of everything that you talked about today, is there anything that you could repeat for a kid? Is there anything that you wouldn't repeat for a kid?
Yeah, absolutely. I mean, pretty much anything that we do most of the things we can do for adults, we do for kids. in kids, the really big difference is that their systems just are a lot more responsive. And so we don't do anything internal with kids. With adults, we like use a gloved finger at the anal sphincter if everyone's good with it, and then we can, you know, tell the anal sphincter to relax, and then that's when we tell poop to come out, and that usually helps a lot. And that's just from like years of tension. In kids, we don't do anything like that, and they don't typically need it. It's like once their system knows, like, we can go to the bathroom. Play works really well, so playing in a deep squat, you know, things like that. They just like respond a lot better to the light interventions. But we do use cupping. Usually they tolerate cupping really well, and then just a lot of like education and making sure that they're setting themselves up for the opportunity to poop.
Because I've seen you on your own kids do an abdominal massage.
Yeah.
So all of that.
Yep. Love the abdominal massage for babies, toddlers, adults, everyone. Yeah, we love the abdominal massage with coconut oil or any just lotion.
And my brain just popped back to, you did a couple reels that we can also link to when we send an email out of just like play activities with kids that gets them into certain positions instead of telling them to do a deep squat. Give them a game.
We love, favorites are like animal races. So like frog jumps are really good because they're really opening the back of the pelvic floor when you get down into that deep squat, kind of opens back here. We do like bear crawls, things like that kind of engage the abdominal musculature too. So that puts pressure on the system to help move things along. Playing like wheelbarrow races. Who knew that was going to be a tongue twister? Putting like their feet and like shins up on like a nugget couch or like a regular couch, and then their hands are down, and like having them color or like do hand tapping games, stuff like that. Obstacle courses.
Get them to move without telling them it's exercise.
Usually.
And if you're an adult and you want to do frog jumps, you can do that.
We all, after dinner at my house, we do a lot of animal races.
Frog.
It's good for your nervous system. It's good for poop.
Perfect.
Magnesium is also typically, definitely check with your doctors, but it's a fairly safe supplement for kids and adults and works really well for getting things moving.
Talk about times to, I've got 3 questions in one. When your routine isn't normal, like I'm thinking when you're traveling or when maybe you're on your period, or what are some different times in your life where you're like, this might be irregular, but that's okay. I don't have to worry about it too much. I think like anytime travel is a good one because I feel like it definitely impacts my system. And just from like, if you're on a plane, just the pressure system alone impacts your system. So making sure you're hydrated, that's a good time to like revisit and make sure you're like really paying attention to the fiber, fluid, physical activity, walk around the airport, drink extra water, electrolytes, make sure you're, trying to eat some sort of fiber rich foods. Typically just travel isn't like great for having like fresh, nice fruits and veggies, so that's a really good time. Usually I also tell people who have struggled with constipation for a long time and get really nervous about it, that the like fear is also like makes our pelvic floors tense. So like when we have a fight or flight response, we tend to like hold tension in our pelvic floor. So actually when I took the course on like rectal stuff and constipation, I was constipated the whole weekend because I was terrified. It's not a normal thing to experience.
No. And so, but I like went on a run in the morning and did my like yoga and still couldn't poop, but it was 2 days. And then when I got home, I just, had a large bowel movement and it was all fine. But and because I had been consistent with the things that I was doing over the weekend, I like pretty much got home, had a bowel movement, and then went like right back into my normal routine. So it's kind of also one of those things where like having just that kind of understanding of like, it's still worth it, even if it's not working right in that moment, because it does help your system in the long run.
You've again practiced.
So,
it's back. That makes sense. Okay. we kind of glazed really fast
Oh,
over
yeah.
what you do in a pelvic floor PT appointment when
Yeah.
you're dealing
Yes.
with somebody with constipation.
I was going to
We
say, we might need to go back to
We got like the main point, but it might have freaked some people out. So do you
For sure.
wanna go
Like I
back
said,
to what
I
that
was a little
looks like?
terrified when
Yeah.
I went to the course. So we've all been there.
Yeah. You want to talk through if this is somebody's first time in a pelvic floor PT appointment, they're coming in with constipation.
It's immediately
Before you put the glove on, what does that look like?
Yes. So we take a really long time to get to know each other. Like usually we talk, our evaluations are 90 minutes, which is a long time, but it really is helpful to make sure we have plenty of time to go through like what's been going on with you. Typically, I'm not like the first stop.
Mhm.
If I am, I'm always like, this is amazing.
Mhm.
But typically it's like, I've been to so-and-so and I've been to GI and, you know,
Mhm.
done all the things. So we talk through all of that, kind of like what works for you, what doesn't work for you, that kind of stuff. And then I go over anatomy every time. So I have my pelvis. We
Mhm.
go over like what the GI system does, what the pelvic floor is, what I kind of just from like what you've said, what I think is generally going on. And then we go through, talk through like what a pelvic floor exam looks like. Sometimes, a lot of times, we like to do an internal assessment, but we don't have to, especially on the first visit. A lot of it is just education and making sure that, you know, are there things we can tweak in what you're already doing? Can we add exercise? Can we do some of like the external, like the cupping, other interventions that we have? Do we just want to work on like your sacral mobility, stuff like that? And then if we want to look at the muscle tissue, then we'll look at the muscle tissue itself. So we can do that. If you're a female, we can do that vaginally. So this is your pubic bone, and then these are your two sits bones. So we have a really nice comfy table that's heated, and then do a vaginal assessment with one gloved finger, check the muscle tissue. And then if we are dealing with constipation or tailbone pain, we typically like to check the anal sphincter, rectal opening as well, and check that like actual muscle tissue there. And then in the back, like all along, kind of like where it attaches to the low back and spine.
Mm-hmm. Makes sense.
Yeah.
A little less scary.
Yeah.
It was just made a mental note. I was like, we'll come back to that.
Yeah, I did. I was like, you're going to be like, oh, Bethany.
No. You deal a lot with, I'm throwing an extra question in for you. You deal a lot with pregnant and postpartum women.
Yeah.
Anything different for pregnant or postpartum bodies?
I mean, hormones play a big role. And so a lot of times that we see that with just periods. And then we also see that kind of get more apparent during pregnancy and postpartum as well. And so it's definitely we might be looking more at during that like time in your life. Do we want to add like a stool softener or things like that? Or has your OB recommended that? Or like what other things can we do in that like kind of more temporary time period because we know our hormones have to be high because we're pregnant. And so there's only so much we can do about that. When we're postpartum, we want to make sure that like if we're breastfeeding, things should be getting back to normal. We shouldn't still be in that like constipated state, needing to take Colace and things for months and months or years. So I don't know if I answered that, but we can still do the internal vaginal and rectal assessment if we need to.
There you go. I know there are a handful of people on here right now. If you have any questions, I've just got one or two more for Dr. Bethany. If you have any questions, drop them in the chat and we will definitely keep an eye on those. One of the things or two of the things that you mentioned, hemorrhoids and anal fissures.
Yes.
If somebody gets to that point and is in a lot of pain or is already experiencing that, is that too late to do anything about it, or what would you do?
No, excuse me. We, depending on how painful it is, we can still do the assessment. Because it's a muscle assessment, like if someone comes in with active hemorrhoids or anal fissures, we typically don't need to do we don't need to aggravate things more. But if things are calmed down, a lot of times like treating the anal sphincter helps it relax. And so it doesn't need, like the pressure is not there. And so that can really help a lot with hemorrhoids and anal sphincter
Fissures.
like
Yeah.
anal fissures. Thank you.
Mhm.
I was like, what did I just say? So yeah, we treat the muscle tissue. If they are flared up, there's still a lot we can do. Like I keep saying we work on the sacrum, but basically like this fascial tissue here, all these nerves, this like S2 nerve root, so the second one down, that nerve root innervates your pelvic floor. And so all of this is like very much like nerve connected, fascia connected. And then if you've ever been pregnant or postpartum, this gets really tight just from needing to like move to let baby come out. Even if you haven't, sometimes this just in response to muscle tension gets really stiff and tight. If you have like low back pain, SI pain, and constipation, all of that typically is connected. So this, like working on this area here, we just kind of like fascially release that area, and that really helps a lot with getting things like moving better, blood flow, getting things calmed down, and helping with the hemorrhoids and anal fissures. So
Makes sense.
Yeah, that's a big one.
Yeah. Going back to kind of the form and things like that, you talked about if things are coming out in little pellets, or on the other end, if you're having diarrhea, or I'm thinking sudden urgency. A lot of people, if they're dealing with sudden urgency, might not equate that with constipation. But you would say
yes. Yeah. A lot of times, even if we feel like we're having like leakage of stool, or all of a sudden we have like an urge and we can't hold it back, a lot of times we're still dealing with constipation. Sometimes not. Sometimes it's actually the muscle tone isn't there to hold poop in. But a lot of times it's like we're letting that build up so much that when we need to hold it back, then we can't, because it's just built up so much in our system that our body is like, must evacuate now.
Yeah. And then you're still dealing with a muscular issue.
Right. Yes. Yeah. But it's tight and weak. So it's like trying to hold either your bowels in all the time or hold poop in all the time. And so it's just really tense, but then it's not able to get a full contract, relax, or relax, contract. It doesn't have full range of motion. And so it just is like tight and weak. So it can't hold things in.
Makes sense.
Yeah.
So I'm just looking at my notes for quick recap. Figuring out whether or not you are constipated is step one, and understanding like what the symptoms are and knowing that is the issue. And then if it is, trying some of those tips that you had about getting up, walking around, doing the different exercises, doing the abdominal massage, the cupping. Also, we talked a lot about posture, how to sit on the toilet, how to breathe. All of that is a good recap. Yeah. And then
one thing I didn't talk about in the posture stuff is we haven't talked about like prolapse.
Okay.
Yeah. So when we have either you can have like a rectal prolapse where this is kind of scary, but
that's okay.
If you've watched this far, you're ready for it, right?
Yes.
Where like the rectum is actually coming out of like the anal sphincter, and then you can also have
cool.
It's not going to happen because you know how to poop. Yes. You're not just like, usually that happens. Typically, there can be other times, but typically that happens from like severe straining over like long periods of time. So you're not scaring my own interviewer here.
Okay.
And then you can also have a rectal prolapse, which is more common, where our like bladder, uterus, and rectum all sit in a line like this inside your pelvis. So bladder's in the front, this is your vaginal canal, and then this is your rectum. And if a lot of times after we've had babies, or if we have tension or a muscle imbalance, organ imbalance, the rectum can kind of fall into that vaginal canal. And so then poop can kind of get stuck in this like pocket, kind of almost in the vaginal canal. And then the squatty potty can help, but then if you have that like prolapse moment, a lot of times people a lot of times do this on their own. But if you aren't doing this and you can kind of feel that pocket, you can like press on the perineum or the vaginal opening, or like insert a finger and kind of push that pocket back, and that can help the stool come out. So
Yeah.
Yeah.
I mean, it makes sense when you know the position.
I know,
that's
isn't it
what you
kind of
would
crazy?
do.
Yeah. It's like people are like embarrassed to tell me. They're like, well, I do this weird thing when I poop. And I'm like, oh, it's called splinting if you're not in the PT world. But I'm like, oh, do you splint? Do you kind of like push your rectum back? And they're like, how'd you know?
You're like, you figured out your own body.
Yeah. So it's a good, not a bad thing to do at all. So.
Yep. Okay, so with all of that information, with the last 3 minutes that we have, if somebody's listening to this and they're like, I think, but I don't know, does my situation require a pelvic floor PT?
Yeah.
Talk about your 15-minute consultation and what that looks like.
Yeah, so we have, you can always call or schedule online a free 15-minute phone consultation with one of our physical therapists. We really like doing that because you can talk to a physical therapist and ask them, your specific questions. A lot of times by the time you get to us, like I said, you've been to several different people. And so it can feel really overwhelming to add another thing onto your plate. And so, you can always call and schedule that like 15-minute consultation to kind of see if pelvic floor PT is right for you and if it's going to help or not. And we're really good I always tell people when PT works, it works. And so if it's not working, then we kind of help you decide like, okay, who's the next person to follow up with, or what else can we do? So we don't like to see people forever and ever and ever. Yeah. It's just kind of like if it's working
here at all if they don't need it. If you're here's one.
That's why we're doing this here, because
here's one trick, try it. If it doesn't work, then come back.
Yeah. The number of times adding a squatty potty is like the magic thing is
we have
not shocking, but shocking. Yeah.
Cool.
Yeah.
Anything else that I forgot or that I should be asking you that I'm not thinking about?
I don't think so. Okay. I think
we covered a lot of ground in 44 minutes.
I know. You really kept me on track because I'm not short-winded, that's for sure. So
you did great. Cool. All right. Well, thank you for joining. We will send the recording of this out along with some links to the stuff that we talked about. Just hit my microphone. And we'll follow up after that.
Yeah.
Cool. Thanks everyone.
The bottom.